Hi, I'm Mahesh Menon.
Hi, I'm Smriti Khanna.
Welcome to another episode of our podcast, Living Well.
And on this episode, we have with us a very special guest. Her name is Dr. Spandana Rayala. Spandana is a dear friend and someone I know in the palliative care community for many years now. She has been a pioneer both India and abroad. Spandana, can we ask you to tell us a few things about yourself?
Hello. Congratulations on the wonderful work. It has been fantastic and also quite satisfying to see you bring all these stories that are not a commonplace in discussion, that don't take a commonplace in discussion. So thank you for that. I'm Spandana Rayala, as you have said. I'm a pediatric palliative care specialist. I do my clinical work right now in Middle East. And I also am the Associate Director of Sunflower Children's Network Towards Cancer Collaboration. And I'm also the Assistant Director of the fellowship that we do through Towards Cancer Collaboration for Pediatric Palliative Care.
That's
So
a lot.
you're a pediatrician by training,
Yes.
and so the first question, of course, is that how did a pediatrician pick up this branch of pediatric palliative care? How did your journey meander towards
At a
this
time where
particular
there
area?
wasn't much pediatric palliative
Exactly.
care. Spandana is, I think, the first fellow in India.
One of the, because we have someone else before me who is still part of the Hyderabad program, and I'm the second fellow. I wish I can give you an inspiring story for my coming into pediatric palliative care. However, it was something as simple as I completed my pediatric residency. So I was MD pediatrics. And then I wanted to do a fellowship in Hyderabad. My father, who has nothing to do with the medicine field, ended up using Google to find out. And he looks at pediatric palliative care fellowship at M&J Cancer Hospital. He takes a printout, brings it home, he shows it to me, and he says, hey, there's a fellowship if you want to do. I read pediatric palliative care. I was like, what is pediatric palliative care? And I Google, and it says, this is for children who are dying or going to die. I was like, but I love children. I don't want to see children die. And I didn't want to do that. But at the end of the whole advertisement, there was a 6-week course that they were advertising for. And I ended up joining the 6-week course just to test the waters and not get into the fellowship. When I did the fellowship, it was with the 6-week course with Dr. Gayatri. She suggested that I join the fellowship and take it up. Lot of deliberations because there's no one else that I'm practicing, even though there are people who completed the fellowship. They weren't practicing it full time. So I was like, but I don't see a future. Should I do it? Should I not do it? And then when I finished the 6 weeks, there was so many things I have noticed during that time that made me think maybe this is for me. I joined the fellowship and I have stayed in the field of pediatric palliative care.
So we know who to thank for you being here in palliative care. So after this is done, we'll call up your father and thank him for that, that advertisement. We've been whenever we've done our podcast, we've come across instances of how people end up in palliative care. Either there are background stories that have real life scenarios which have prompted them to enter this, or it's been serendipity and it's just clicked. And it's beautiful to see how it has evolved. And now you moved from India and you're in a leadership role and you're also practicing in the Middle East. So how's the pediatric palliative care culture now that you have worked in different health settings? What is your observation about different settings, about pediatric palliative care?
I think that's a very interesting question because a lot of the times people end up thinking that pediatric palliative care is needed because the healthcare system is broken or it is not catering to everybody. But then having seen Middle East, places that do have a lot of money, you still see the need. So it doesn't matter whether you have access to the best of the treatments, people still end up needing palliative care. We wish it is not so. But based on the condition that they have, based on the treatments that they have received, but also the natural history of the disease, it's no fault of anybody, not the healthcare system, not the doctor, not the field of medicine or the families, but they end up needing it. And so it's a global need that cannot be denied.
You can have universal healthcare and still need pediatric palliative care. Yeah.
Because there will always be that group of people who may, have diseases which are not curable,
Yeah.
have
Yeah.
different conditions which will need palliative care.
Yeah, yeah,
Agreed.
absolutely. I also wanted to know a little bit about your work at Towards Cancer and the fellowship that you are saying. I think that this is one of the most successful fellowships worldwide in pediatric palliative care.
You can see my smile. I'm very proud of what we do at Two Worlds, and having been a person who has benefited it myself, I have done the fellowship which was supported by Two Worlds in Hyderabad. And when this concept of doing a hybrid fellowship that came up, doing part online and also getting good clinical exposure, we started it during COVID. COVID, I think, was the mother of a lot of innovations that we had to do.
Yeah, yeah.
And they got good exposure in Hyderabad, the first batch. And we saw how successful it was, because once they finished it, they became pioneers within their own countries. Because of the place that we are located in, most of the times it's through India and all around the world. We offer it to Southeast Asia and South Asia. So I think we have trained fellows from 7 countries now.
Wow.
India, Pakistan, Bangladesh, Nepal, and Philippines.
Yeah.
I don't know if I'm missing some. Bhutan and Vietnam have joined the fold this year. And all of them are still, so again, the other thing with a lot of fellowships, education programs is you do it and you leave. Yes, we call it our alma mater and all these things, but we are not in that active touch. I think that's the other thing, Sunflower Children's Network. It's truly a network that we are all still in touch, a very much active group.
Okay.
People who graduated and became fellows join us as faculty observers for some time, and they're still learning how to teach after their fellowship is done while doing their own clinical practice. And then after a period of time, we invite them to be faculty too. So it's something they receive from the community and they're giving back to community. I think that is one huge strength of the fellowship.
So I get this structure, but I didn't understand the mechanism. Suppose someone has to apply de novo for this. One, what are the eligibility, and what is this organization, Sunflower Children's Network?
So the eligibility part is we invite pediatricians, but in some exceptional circumstances with institutional support, we have taken palliative medicine graduates too into the program.
Okay.
And Sunflower Children's Network is a Two Worlds Cancer Collaborations Initiative, which is a Canadian-based charity organization, which focuses on ensuring good cancer control, cancer treatment, but also most of the times in the trajectory of cancer, we do need palliative care.
Yeah.
So that's how they ended up starting as a cancer control and treatment organization, but embracing the palliative care aspect of it.
Yeah.
And then because they were supporting the fellowship in Hyderabad, they ended up getting some very strong faculty to support the fellowship. And that kind of grew in its own right and became the Sunflower Children's Network.
Oh, wow.
And then we were getting a lot of requests to do the Hyderabad fellowship, which is an in-person fellowship. And these requests were coming from countries other than India. And as you know, it's very difficult bringing somebody into India without registration, letting them practice and all that. So that's when this idea of hybrid fellowship came up. And in this way, we are able to accommodate people from other countries. And the fellowship curriculum has been rigorously checked by Royal College of UK, and they have said this meets their standards, and it's endorsed by RCPCH, Royal College of Pediatrics and Child Health of the UK. So it kind of makes it more robust and authentic for people to apply to.
Why are they called Two Worlds?
So I think my understanding of Two Worlds is we're all living on this one world, but the experiences that we have based on the geography are completely different. We might as well be living in 2 different worlds. So I think Two Worlds Cancer Collaboration makes sense to me, but I don't know if that is why they have named it. I have to confirm with the people who have started it, but this is what I have always felt. It makes so much sense.
Okay. So and once they apply, what is the duration of the fellowship? Is it a year? Or?
Yes, it's a 1 full year fellowship. It's quite rigorous if you ask.
I'm sure, because if your curriculum is to be vetted by the Royal College of Pediatricians, then I think it has to be.
But I think it must be such an amazing feeling you are actually getting in people who are interested in pediatric palliative care from countries that have little to no access to this service. So this means that the people who go back after being fellows in this program are actually going to pioneer pediatric palliative care services in their own country. Is that something that has happened, and how has the experience been for the fellows?
Do you have any examples that you can share with us?
Yeah, I'm just thinking, when you were asking that, I was thinking the exact same thing. So one of our fellow who just graduated has started a pediatric palliative care service in a public tertiary hospital in a major city in India. And she was texting about this child without revealing the details, of course, but she was talking about the clinical aspects, and we were all brainstorming of how she can help the child. And then she texted me back last night saying that the primary doctor who gave the referral said that we should publish a case report of how we helped the child, and people need to know what palliative care is doing. So it's
so inspiring.
And it is just after graduating, right? So and a lot of our faculty, all of the faculty, are volunteers. So we don't charge from the fellows. We offer a scholarship, but it costs money, which comes through funding, donations. And all the faculty are volunteering their time. So we are very protective of our faculty, use them in the right way, but also make sure they know what's happening, because when you're giving something for free, you want to know what you're contributing to. And I think these are the stories that are very powerful. One of our fellow, again from a different country, recently graduated. There is no pediatric palliative care service anywhere in the country, and it's a tertiary premier hospital. And he has started the outpatient department over there. And our team is going in the next week, and we are super excited to see the pictures of what they're doing there.
That's another thing which I know that Two Worlds does. A lot of site visits, a lot of going back to the place where actually the people are working, trying to see how they are managing in their own setting with their own resources, and just offering additional support, additional sort of inputs, isn't it?
Yeah, I think that's the other part of training and education that I think we miss, is we train them. And I was just reading somewhere that the education program, no matter how robust you make it, if you cannot change the ground reality for the people who go back, it wouldn't make a difference.
It does not make sense.
So I think Two Worlds is very committed. I'm not saying change the world, but I hope we change the world, but at least make a difference for the fellows. So most of the fellows still receive site visits. We have, I know you have access to it. We have an Excel sheet where we say, these are all the places we are committed to help this year, and who can go to which place. And we sponsor the visits through Two Worlds, and we go there, and we do quite a bit of advocacy during that time. We meet all the head of the hospitals, ministers of health, whoever can move the thing forward, right? And at the same time, because again, I'm related to the organization part of fellowship, we try and advertise as much as possible for fellowship, because we want high-level candidates for the fellowship. And it has been that, like last year, I think we got 20 applications from very high level. We were struggling to choose the right ones, because we do not have the bandwidth to take everybody. And we are very thrilled to see that it keeps increasing every year. And then the leadership aspect of it. So when you're advocating for it, and this is coming from people who have done it in many countries before, and the person who just graduated is along with you and seeing what you're doing, even when you leave the place, they know how to pick up the thread and go along with it. So the advocacy keeps going on.
And these things really help in terms of advocacy. Because you can advocate at a state level or at a national level, but advocating in your place of work is, first of all, it's not something that most people have to do, because their branch is already established. A hospital needs a surgeon, a cardiologist, an anesthetist. But in so many hospitals, the need for the palliative care physician is not well established. And so, in fact, palliative care is special in that you also have to advocate in your place of work that there is a need, there is an unmet need over here that needs to be filled. that needs to be
And
looked
the
at.
most common question is like, what are you going to do? And sometimes fellows don't feel strong enough to tell like 20 years their senior what they can do, or they cannot demonstrate it. So when we are there, we try and help them formulate a plan about how to show the impact of palliative care. So I was telling this fellow who has recently graduated, when she shared the success story of her treatment, that you need to go back, you need to ask the mother to go back and tell the primary team what has happened with her child. And she said, yes, it has already been done. So it's wonderful to see that happen.
So yeah, and that's very heartening to see that you're ensuring continuity in supporting your fellows who pass out also, because I'm sure that they are also going to become similar in their approach. They will help people in the future, and your network is only going to grow stronger. You mentioned something about going to different sites and meeting health leaders, like political leaders and all of that. Do you have any interesting stories to share from any of these visits, where anything that you've learned, or any interactions with leadership, and whether it has made a difference, that you've gone there and something different has happened?
First thing is the reflections that happen while we are there and even afterwards. I think it gives you insights into how different people are. Like people who support palliative care in words but not in actions. Some people who don't talk so much but help you in the actual action part. So just I think after a period you kind of get a feel of what's happening in the moment.
Correct.
And it helps you change your stance in how you pitch the idea to the other person. So I call it why firm, which is what is in it for me. So when we are explaining to people, it's not something they deliberately think about, but they're thinking, okay, if I do this, what's going to happen? Right? And some people are motivated by good patient care, patient satisfaction, more children will be benefited. And if you can identify those people, that is what we would pitch for. But then some people are really motivated by, this would be the first ever pediatric palliative care center within this country.
Correct.
And that gives them a huge incentive to do that.
That's a milestone.
So we do that sometimes. So that is one thing I'm thinking about. And the other thing that came into my mind when you asked that question is, last time, one of our expert who visited the site, it just so happened that meeting with the WHO leader of that place was arranged. Like, she's leader for the overall region. And the WHO leader was so motivated, and she said, okay, is it okay if I give you 4 hours and you can give a presentation? And the local leader and our expert who went there just sat, prepared the presentation, and this leader brought in 15 different people, some of them from different sites, and things have started moving because of that. So sometimes you are there at the right time, right place too.
And this attitude is very important. I guess even if you were there at the right time, right place, if you hadn't made that effort to connect with leadership, it would have been a waste. So I think all of that helps. Quite a bit.
Totally, absolutely. Amazing. And I think that there is another aspect that TUWALS is also helping promote, which is the Leadership Institute. TUWALS is also playing a part in it. I'll leave you to tell us what part they are playing. But I find this idea of leadership in palliative care very interesting, mainly because it's almost as if all of us who have learned palliative care or who have gone through palliative care, it has been drilled in our minds, this idea that we have to advocate. Not all doctors advocate for their specialties, but as a palliative care professional, you end up having to advocate always. And so leadership skills is something that is very important for all of us. So can you tell us a little bit about the Leadership Institute?
So last year, for the first time, we have piloted a Children's Palliative Care Leadership Institute. TUWALS is leading it, but we have several collaborators and partners who are the global voices for children with serious health-related suffering. And what we do through this is, again, I think we have focused on South Asia, Southeast Asia for the first iteration, and also the second, which we are running right now, is that we send out applications, and we do get many, many applications, which we filter through because they have to write a project proposal that they're going to do. And last year we have 9 scholars who have successfully completed it, and they have done 19 did I say 9 scholars? It's 19 scholars. and they did 19 different pediatric palliative care projects.
Wonderful.
Why
wonderful.
do you guys reject all my applications?
As I said,
7 years I've been applying.
As I said,
This is why I did this podcast, to ask you in front of the camera. Tell me what is wrong with me.
we do have a very objective rubric, and
Correct.
if your application meets the standard, we would definitely be happy to invite you.
Thank you for telling me this.
There.
There, yeah.
There.
No sensitivity at all. How do you break bad news?
I'll bring out the tissue.
Tissue now. But on again, coming back to BC, this is amazing initiative. You've sent out the applications and you have done this leadership part. What is your message out there? What are you trying to tell people in healthcare?
Mm-hmm.
Because we've asked a few people this question about leadership. What is the role of leadership in healthcare? We know from the COVID pandemic onwards, we've seen what good and bad leadership can do. And in this field of palliative care or healthcare in general, what are your views on leadership and how would you talk about it to someone who wants to take it up in the future?
I think there's several components, moving parts when we are thinking about leadership in itself. One of it would be like a vision. It doesn't have to be clear, but you need to have like an overarching huge picture that you're looking at that you want to do. Then the open-mindedness, and that's why I said it doesn't have to be clear, because being open-minded, pitching this idea to several people, sharing with people, I think it helps us refine it further, right? So that is one part of it. And also understanding the situation itself, like where do I want to do it? Is it a public hospital? Is it a private hospital? Or am I trying to do it within the community? So those are the things, I think, understanding that part of it. But beyond anything else, I think resilience, because as you said, palliative care is the newest kid on the block. So everyone is always asking you, why are you here? Like they're questioning your very presence. So I think palliative care leaders need to be resilient enough to say, yes, I deserve this place and I'm going to be here and I'm going to keep showing up because this is important work. So I think that is the part where leadership, it's like when they keep closing the door, you should still be able to knock and sometimes just open it and enter the room. I think that's what leaders need to have.
Amazing. So what you shared about being open-minded, if you look at conventional thinking, we perceive leaders as being close-minded and just following their own diktats and their own perceptions.
Yeah.
But I believe that a true leader might, as you said, be so open-minded that they involve everyone and they know exactly how to take the ship forward. You know? So
definitely, it's a collective vision, I think, at the end of the day, and that's what keeps people inspired and motivated to put in the work they put in. I think that's why, again, our fellowship, I'm so proud of the faculty who give their time so freely, so generously, is because they believe in that collective vision that this world needs access to better palliative care, and them giving away that time is going to contribute to it. So
I think we can all say clearly, like, we are all faculty for the fellowship, and
I am faculty for that fellowship also.
That's why they rejected your application, because you're teaching them in the first place.
That's a good one. I should have said that.
You should have said
I
that.
should have said that.
You didn't have to go with, no, your application didn't meet the standards. So embarrassing.
I'm trying to be the...
All on camera.
I'm trying to be the director. Something.
She's trying to do her director role and just try to say that
I'm
we
being very
maintain
objective.
objectivity. Okay. So where was I now?
See, I always sidetrack her with these.
No.
Let us wait for her to gather her question.
No, I'm going to talk about another thing.
Mm-hmm.
In my first year of working in palliative care, I was asked by someone, why are you doing this? You know, you're fresh out of your post-graduation, just a few years out of your post-graduation. Why are you doing this? This is palliative care is something that people do towards the end of their career.
It's like a retirement.
It's a retirement career. And I was very taken aback. Like, I have come into this place with so much enthusiasm and so many things in my head and so many ideas that I want to execute. And to hear that is disheartening. And that point you said about resilience, like you have to know that, okay, you have to get past this, that there is something to be gained by getting past this. It's a very important thing. And I think that that's the reason why it's so important to have leadership institute, and have a leadership institute where young physicians or young pediatricians can actually join in. It's not just for somebody who's mid-career or late career. It is even for someone who's early career, because that's where you have to start honing your skills in palliative care.
Amazing. So, anyone who's like listening to this podcast, who's say a pediatrician listening to this podcast, and just passed out from medical, post graduation, and they want to pursue a career in pediatric palliative care, what would your advice be to them? Like they say they have different choices: pediatric neurology, pediatric cardiology, pediatric palliative, like subspecialty. What would your advice be? I believe you've also passed the MRCPCH, and so many nuances. What will you advise these children?
I want to say that pediatric palliative care, just like any other branch, like it takes a certain kind of person to enjoy anesthesia, right? Like it takes a certain kind of person to take up ICU work, someone emergency doctor. So it takes a certain kind of person. In the same way, I think it takes a certain kind of inspiration, motivation to take up pediatric palliative care. So do listen to that. If it feels that it resonates with you, I think that would be the first step, thinking about that. The second step is, there is this whole thing about primary palliative care, secondary palliative care, and tertiary palliative care. Not everyone has to become a specialist in it. So, but all of us have to know like the basic principles, so that any child we see, even if I'm a general pediatrician, I end up getting a Down syndrome child with a heart condition which is inoperable. It would help me to know the principles of palliative care to give better care for this child and family. So just remembering that the primary part and the secondary part are also equally important. But if the force moves you, I think you should apply for fellowships. There are many other programs out there, and explore it, and also probably visit the places. The other thing I wanted to say was, a lot of the times it's construed that pediatric palliative care or even palliative care is translated to tender loving care. And so this reminds me of a fellow I taught last year. I was teaching the whole group about gastrointestinal symptoms in pediatric palliative care. And I finished the whole session. And this is for pediatricians. And this fellow, you know her, she's a pediatric oncologist who's very passionate, so passionate that she wants to learn a high-level fellowship, pediatric palliative care, and integrate into her practice. Oncology. So she has joined this fellowship, and at the end of the Q&A and everything else, I said, any more reflections, anything you want to say? And she goes, Spandana, can I say something? And I say, go ahead. And she says, even after doing many, many basic pediatric palliative care courses, she says, somehow pediatric palliative care always, I feel it is tender loving care. But listening to your session today, I can see how medical it can be. So I think a lot of the pediatricians also take a step back, thinking all I'm going to do is that counseling, holding hands and things like that. But it's not just that.
There's a lot of science.
And there are, I think, competencies in every field of it. If you are talking about communication, there are competencies in that. If you're talking about breaking bad news, there are competencies there.
Therapeutics, prognostication, the diagnosis itself.
Prognostication is a competency which not many people learn nowadays.
Highly symptomatic children, sometimes when we see them, end of life care, sometimes it's as intensive care.
Yes.
Absolutely.
So
taking care of a child at the end of life is like taking care of a child in the ICU. Only it's harder because you're taking care of the child at home, and there isn't that much support that you would get in an ICU.
So definitely it's a very challenging branch if that's what you want to do, but it's also a very satisfying branch at the end of the day. I know a lot of people keep asking, why do you work in such a sad branch? But I tell them, I know it feels sad, but there are so many times I have told families that your child is dying, and the word that comes at the end of the conversation is thank you. Can you believe
Which
that?
is insane
they say
to
thank
believe.
you. I'm telling their only child or their 10-year-old child, 15-year-old child is dying, and they say at the end of it, thank you for saying it so well. Thank you for being the first person who explained this to me. So I just want to say it is challenging, but it's equally so gratifying to do pediatric palliative care.
One more question I have for all the budding, say, pediatric palliative care physicians out there, you are actually doing so many roles. You're working in different health systems. There's always this worry about, okay, if I learn this specialty, what is the scope when I go out and go and practice in the community or in any health system? What is your understanding of this? Is there a good scope for a pediatric palliative care?
I think things are changing from when I did my fellowship. I think things were a little more challenging. I wouldn't say all the challenges are gone, but things are definitely changing. So I see that, as I said, some of the fellows within the country are starting their own services within their hospitals. The challenge is that they're still doing their primary job and
Yeah.
trying to juggle this because they're very passionate about it and they want to help children right now.
Yeah.
So they're doing it. That is the tough part, but the doors are opening. And we hope through advocacy, through creating awareness, and also involving health leaders in this conversation, the ones who can actually arrange the funding, positions, and everything else, I think things are going to change a lot.
Yeah.
Because I believe it's initially starts off like in adult palliative care. It starts as a part of adult oncology. They say,
Yeah.
okay, let's get palliative care.
Yeah.
And then it starts with pediatric oncology.
Yeah.
But then there's the percentage of children who require palliative care with oncology
Less
and the
than 5.
non-oncology is so different. So I
Yeah.
guess
And then it
till-
slowly grows into that.
absolutely.
Yeah.
So we have to just wait for that time, and that is happening now.
Mm.
As you see a lot of focus in pediatric subspecializations, I'm sure this will become part of the mainstream soon. So there is plenty of scope
Yeah.
for someone
Yeah,
who's
yeah, yeah,
good at
yeah.
This would be so wonderful to see.
and you're doing a great job creating more and more talent into the pool.
Yeah.
I noticed that the applicants that you mentioned were all doctors. Is there something in parallel for nursing and other support systems for in palliative care?
I think that is one of the dreams that we have at our organization, and how to help with capacity building for nurses and other professionals.
Leadership Institute is open to
Leadership
nurses.
is open for everybody.
Everyone. Okay,
Yeah,
this is
yeah.
what I
It's
wanted to
for
understand.
doctors, nurses, program managers, social workers, and everybody else who is working in the field of palliative care. But also we do a lot of awareness sessions. We do 6-week online sessions, 1.5 hour each, and that we open for everybody.
Okay.
Doctors, nurses, social workers, physiotherapists, all the allied health. So I think we are trying, but we need a little more focus on, as you have said, nurses and allied health professionals.
What does living well mean to you?
So living well to me is matching what I want to what can I actually get. And I mean it in terms of health. Like, I want to be healthy, and sometimes the system, the place we are in doesn't support that. And how do we get to that point? So I don't know if I'm making sense right now.
Is it related to self-care? Is it related to having enough time for, say, working out or de-stressing?
I think it's everything. It's like the self-care part of it, but also I'm thinking about, if I do end up having a serious illness, what I want would be very different from what the system in itself is able to offer right now.
Interesting.
So
Yeah.
This is very interesting because you're probably one of the first people who've answered this question of living well in the context of the environment around you.
Yeah. Yeah.
That everyone says living well, they want to be healthy and fine, but we are ignoring one basic aspect, that you can be as healthy and fine as the world around you allows
Yeah.
it.
Yeah.
Beautiful.
It has to facilitate it. I cannot do it by myself. So that's
Yeah.
something I always think about.
We wish you all the best with all your leadership roles and with your career ahead. And
Thank you so
for
much.
being part of this podcast.
Thank you,
Thank
Spandana.
you. Thank you for taking the time to talk to me. Thank you.